Rapid fire Q&A about vertigo and dizziness problems. My name's Amy. I'm a vestibular physical therapist, which means I treat dizziness and balance problems for a living. And these are some of the most common questions I receive from you, the viewers. If your doctor diagnoses you with vertigo, you need a new doctor. Vertigo is not a diagnosis, it is a symptom. Them diagnosing you with vertigo is like you're going to them with a stomach ache and them diagnosing you with stomach ache or nausea. That doesn't really solve the problem. It doesn't really tell you what's causing the vertigo. Usually vertigo is caused by a few different conditions. It can be many different conditions that produce this disorder, but the most common one that doctors will diagnose you with vertigo for is called BPPV, benign paroxysmal positional vertigo. That's the one that requires you to do maneuvers to resolve it. Other forms of vertigo come from different disorders that maneuvers will not treat, such as vestibular migraine or Meniere's disease, for instance. When should you do maneuvers? Only when you have active BPPV. How do you know you have active BPPV? Well, first of all, you will have a sudden and severe onset of vertigo symptoms that you did not have the day before. So it'll be pretty obvious that you have a sudden onset of vertigo. You will also do something called the Dix-Hallpike test. Your doctor can do that for you, or I have an informational video on that pinned on my page. Do that test to see if you have active BPPV. You only have to do the maneuver if you have active BPPV until you no longer have it active anymore. It should also resolve symptoms if you are doing the maneuver and it's as a result of BPPV. So if you're doing the maneuver and it's not resolving your symptoms, you likely don't have BPPV, or you're doing the maneuver wrong, or you maybe need a different maneuver and you should go to the doctor. There are many other exercises besides maneuvers that vestibular physical therapists will prescribe for patients who are experiencing dizziness and imbalanced symptoms. They often involve closing your eyes, moving your body, doing balance exercises, looking at things and moving your head, doing head-eye coordination activities, or looking at moving visuals. There is a huge combination of exercises you can do besides maneuvers to exercise your vestibular system, and those would be employed after BPPV is resolved if a patient has residual dizziness, or if you have any other disorders with vestibular dysfunction that causes dizziness and imbalanced symptoms. Most vestibular PT plans of care range between 4 and 12 weeks, depending on the severity of your symptoms, the diagnosis that you may or may not have, and how you're responding to treatment. Most people have reached plateau at about 12 weeks. If they are not fully resolved by that point, we will give you ways to modify your lifestyle to reduce the stimuli coming your way in order to reduce your dizziness symptoms, but the goal is always to resolve the dizziness if we can. There are some disorders that are not curable by the traditional sense, in that we are going to make you reach a peak level of management for that condition where your dizziness symptoms are under control or vastly reduced, but they are not completely resolvable, and at that point we're looking for a peak. There are many disorders though that are completely curable, like BPPV, and can be completely resolved with vestibular PT. So there you have it, a few different vestibular PT questions that I get often. Stay tuned for more vestibular content.